Cancer Conversations, a Harold Leever Regional Cancer Center podcast discussing all things cancer and giving you information to improve yours or a loved one's cancer journey. Hello and welcome to Leever Cancer Conversations from the Harold Leever Regional Cancer Center. Today we're happy to welcome Dr. Joseph Ravalese III, MD, radiation oncologist at the Harold Leever Regional Cancer Center, to talk about Dupuytren's contracture. We'll be discussing what it is, symptoms, diagnosis, and treatment. Hello, Dr. Ravalese. You're very welcome.
Great to be here. Thank you for the opportunity to discuss the treatment of Dupuytren's disease, something that I have specialized in within our department at the Harold Leever Regional Cancer Center. As you may know, radiation therapy is an important component of today's multidisciplinary cancer treatments. But did you know that it also can be used for diseases that are not cancers? We call them benign diseases. These benign diseases, like Dupuytren's, are not cancers but can be responsive to modest doses of radiation.
To get started, what is Dupuytren's contracture disease?
In several sites in our body, we have tough, fibrous connective tissue beneath our skin called fascia. This helps to protect the underlying blood vessels, tendons, and nerves. In Dupuytren's disease, the fascia undergoes a progressive process causing nodules and cords that you can feel and sometimes see in the palm of your hand along the finger tendons. This can tighten the tendons, resulting in flexion of the fingers. This disease is not exclusive to the hands, but also is seen in areas of fascia in the feet, known as Lederho's disease, and in the penis, known as Peyronie's disease.
Are some people more prone to Dupuytren's disease?
The prevalence of Dupuytren's disease in the United States is about 3 to 5%. However, there are populations that have much greater risks. These include our Northern European descents, like Nordic, German, Irish, people who have diabetes, some people on medications, alcohol, tobacco, certain repetitive or vibratory activities. We think of people with jackhammers on the side of the road. And in some families, they have Dupuytren's that goes through generations. Generally, it's a disease that is seen more in men than women.
What are the signs and symptoms to look for?
Generally, this disease starts out as a thickening of tendons in the palm of the hand with some nodules. These are non-painful. However, as the disease progresses, the cords begin to tighten, as I mentioned before, and this causes tightening involving the fingers. It's generally at this point that patients are most concerned, as their flexed finger makes it difficult to do activities of daily living. Shaking somebody's hand, putting on your glove, trying to do a push-up, trying to get the hand flat to the floor. These are all made much more difficult when you have a contracture of your finger. The thickened cords and nodules in the hand can be uncomfortable when gripping tools and weights sometimes. Another common process in the palm of the hand that is related to fibrosis of the tendon is called trigger finger, for which radiation is not effective. Therefore, it is important for patients to be appropriately diagnosed with Dupuytren's disease to receive the appropriate treatments.
So tell us about diagnosis.
Commonly in the United States, patients are referred to hand surgeons when they present with early stages of the Dupuytren's disease. With the advent of social media, many patients seek medical knowledge on the internet. They refer themselves to either the hand surgeons or self-referral to my department. I believe it's important for a patient to see a hand surgeon, since this specialist performs many of the different procedures that may be done for Dupuytren's disease. Additionally, Dupuytren's disease can have a waxing or waning course. That means it sometimes can get better and sometimes doesn't change for years on end. It is also important to follow disease because once it has progressed with significant flexion of the fingers, there may be very little role for radiation at that time, and the patient may have to undergo the invasive therapies.
And if a patient is diagnosed with Dupuytren's, what are the different types of treatments that may be used?
When we establish that the patient has had progressive Dupuytren's disease, the types of treatments are as follows. The surgeon can perform collagenase injections. This is an enzyme that helps to dissolve the fascial region. A needle fasciotomy, once again done by the hand surgeons, which a needle is inserted to break up the fascia. A limited or partial fasciectomy, which will remove portion of the fascia causing trouble. And this is again done by the hand surgeon. Most invasive is the total fasciectomy, where skin may be removed and a graft may be needed to remove a much larger area of the involved Dupuytrens.
So where does radiation play a role in this disease?
In Europe, and particularly Germany, the treatment of Dupuytren's disease with radiation has been used in early disease process to prevent progression. Patients have been seeking out earlier treatments that may delay or prevent deformities and avoid the need for more aggressive treatments like surgery.
What treatment does the Leever Cancer Center offer?
I have been in the forefront of bringing radiation treatments to patients in our community for several years. Generally, the patient will be referred to me by a hand surgeon, or now in the world of the internet, by their social media groups discussing Dupuytren's, the patients will self-refer. The first appointment is called a consultation. It establishes the need to either be treated with radiation, be treated with surgery, or maybe the disease can continue to be followed. Daily radiation treatments are Monday through Friday over 1 week. The course is called a split course, where there is a break of 4 to 6 weeks, and then a second week is given. Treatments take 30 minutes or less. The high energy particles, called electrons, go to a certain depth and stop within the palm of the hand. The patients feel no different before or after a radiation treatment. They're never radioactive. They don't glow in the dark. They have no hair loss, and they do not get sick to their stomach. Skin reactions of redness, dryness, tanning in the treatment region are not uncommon.
Do you have any other thoughts to share?
I would say in today's modern treatment of Dupuytren's disease, a patient should have a consultation with not only a surgeon, but a radiation oncologist. And this will allow them to be well informed of their treatment options. Although in the United States, radiation approaches have been less common for Dupuytren's disease, patients have empowered themselves with the internet and their social media groups specific for Dupuytren's to have the information they need to make the appropriate decisions for their care. In my practice, patients have been pleased with the results of the radiation treatments. Generally, success is 80 to 90% of patients with only a 5% risk of recurrence.
That's good news. Thank you for being with us today, Dr. Ravalese, and sharing your expertise. We look forward to talking with you again soon in the future.
Thank you.
Be sure to check out our website, levercancercenter.org, for more great content and new podcasts. Content produced by Leever Cancer Conversations is for the community and is for education purposes only. We do not diagnose, treat, or offer patient advice. Thanks so much for listening.